All right, in this video, we're going to be talking about the three most common diagnoses or types of hip pain, focusing a lot on osteoarthritis as that's the most common. But that happens to be number one, right? So osteoarthritis, also known as joint space narrowing or degenerative joint disease. And then my least favorite name is bone on bone, and I'll tell you why in a little bit. Number two is hip bursitis, and then number three is labral tears. So let's talk about osteoarthritis first. Definitely by far the most common, the common issue that I hear people that they're told that's why their hip is hurting. It's described as a loss of cartilage. The cartilage is wearing out, which is true as we age. Joint space is narrowing, which is what is measured on the imaging, the x-rays. Yes, that's true. That's part of natural aging. But as we mentioned earlier, there's a lot of research to back up that osteoarthritis does not equal pain, and it's actually natural, and it's hard to find somebody that's aging that doesn't have it. It's just like our skin changes as we get older, but our skin doesn't automatically hurt because we're getting older and wrinkly. It's also known as bone on bone. There's things called osteophytes, which are these little growths of bone along the joint line. Bone spurs is another word for osteoarthritis. And of those three, when you start talking about, four, osteophytes and bone spurs, those are kind of typically surgical situations. You want to remove the spurs. But when you start looking at loss of cartilage, joint space narrowing, and bone on bone as the description of arthritis, we know that's natural. We know it's happening to everybody, and some people have pain, some don't. And from my perspective, the pain is not caused by the arthritis, and research backs that up. So we know that as cartilage wears out, that it doesn't have any nerves, right? It's aneural. So that's unlikely to be a direct cause of hip pain. It's just not. We know, we talked earlier about a systematic review. We know that that's a high level of research where over 10,000 patients were indicated 80% of people over 63 had an MRI indicating arthritis, yet only 13% had pain. So if arthritis was the cause, you'd see closer to 80% having pain. So arthritis is not directly the cause. It is part of the aging process. You know, if we were to look up images on Google, here's what, a healthy image, this little animation. In a arthritic, eroded joint, I mean, look at the words, eroded. It's just aging. You know, it doesn't equal pain. We kind of talked about that already. So the reason I don't like bone on bone as a description, it's a myth, right? So my doctoral thesis when I was in graduate school to become a physical therapist measured what happens to shoes as runners wear them out, right? And so what we found was that we had force platforms on treadmills and all kinds of measurement tools. And we identified that for every time when you're walking, when your foot hits the ground, 2 to 3 times your body weight travels through your foot, through your knee, and through your hip. So that means if I'm 200 pounds, that's upwards of 600 pounds of force that has to go through my hip every time I'm walking. Now, running, it goes up to 5 times your body weight, so 1,000 pounds of force for me. And we know that if the bones were actually touching, so the femur and the pelvis were actually touching, the bones hitting each other with that much force, bones aren't that strong. They're not metal. They're not titanium. And so if the bones were to hit that hard, you would have at minimum bone bruising, but more likely you'd have bone fracturing, bone fragments. You'd have bone that's dead on the top of the femur. And so, you know, it only takes 800 pounds of force to break a femur, which is the biggest bone in the body. So simply put, bone on bone, your bones would be in terrible shape if they were touching. They're not touching because they're in an enclosed capsular space with fluid inside. And that fluid and the soft tissues, muscles, tendons, ligaments, they suspend our joints in tension. And so their job is to keep the bones from each other. And there's fluid inside, so there's hydraulic pressure to keep you know, the bones from touching. So, and then also, if I truly had a hip that was bone on bone, if we have 2 bones that come together to create a space, the space is where the movement occurs. if the bones were truly touching, we would have no movement because there'd be no space. So you got to think through that and recognize that that's kind of like, I think, a fear-mongering, metaphor of what's really going on. And so if you want to learn more about that, I would encourage you to look up the biotensegrity model of anatomy. It's actually written and published by an orthopedic surgeon, and it talks about how our body is one essentially tension network, and bones don't touch, bottom line there. So, arthritis is a thing. It's real. We can't make it go away, but it's not the direct cause of pain. And so let's move on to our second type of hip pain. It's most common diagnoses. And by the way, these three types, or the diagnoses, what you're going to find is the diagnosis is not, or the type is not the same thing as the cause. So here we are with a labral tear. If you look at the socket in the hip, we have a socket, we have a ball in the socket, and around the socket there's a cartilage rim or ring. And that is really designed to kind of make the socket deeper so there's more congruency in the hip. And typically, pain that is increased when it's deep inside, when the hip flexes, when it moves away from the body and turns outward, is commonly when people have pain with it. However, there was another study again, 69% of people over 37 years old on an MRI had this, but no pain at all. Because we know the labrum itself is aneural. It's cartilage. It doesn't have nerve endings. It doesn't have a blood supply, doesn't have nerve endings. So we know that the labral tear is not something that we should be surgically, cutting out of us or using as a diagnostic tool. It is something that happened. It changed our body structure. But I would argue that the movement, the abnormal movement that caused the labral tear is really the dysfunction. So we've got to go back a little bit and try to identify the abnormal movement. And then finally, hip joint or hip bursitis. And so a bursa is a fluid-filled sac. We have them all over the body. The most common one in the hip is on kind of the lateral aspect, right in the top of the femur. And the fluid-filled sac is designed to be in between where a muscle turns into a tendon and then attaches to the bone. That fluid-filled sac is right where the tendon attaches to the bone so the tendon doesn't rub on the bone. Typically you'll find them in the body along bony prominences so that the tendon doesn't fray like a rope. Now, there's a big one in the outside of the hip called the trochanteric bursa. That's most commonly what we see, and you can tell when you have bursitis because you can feel it. You can push on it and actually feel it. If you've had something deep inside the joint, you're not going to push on the outside of the hip and feel more pain. So a bursa is a fluid-filled sac, and they get inflamed when there's more friction, more movement in that area than there's supposed to be. It causes friction, and that friction causes inflammation, just like a blister on your skin. So they all have in common one thing. It's called inflammation, and we talked about that, but inflammation is a really important part of the healing process. So we've got to back up and say, what's actually causing this inflammation? And in this case, it's movement, excessive movement in these regions that are getting inflamed. So there you go. There you have the three most common types of hip pain.